All right, today we are diving into a huge technological breakthrough, one that could totally change the game for emergency medicine. We're talking about giving medics an AI co-pilot for those incredibly high-stakes, life-or-death decisions. Let's jump in.
So think about a really intense trauma situation, maybe a battlefield or a bad car wreck out in the middle of nowhere. The biggest killer in those moments is often the injury you can't even see. It's called internal hemorrhage, basically severe bleeding happening inside the body. And finding it fast, it's not just important, it is literally the difference between life and death.
Okay, so let's put ourselves right in the boots of that medic. It's chaotic, it's probably dark, you don't have a whole hospital at your disposal, and you have to make a call, right now. How on earth do you find that invisible internal bleeding when you can feel every single second ticking by?
Well, for a while now, the best tool we've had for this exact job is a portable ultrasound machine. It's an amazing piece of tech, but, and this is a big but, it comes with one massive catch.
Yeah, it's called point-of-care ultrasound, or POCUS for short, and it is an absolutely incredible piece of kit. It lets a medic literally see inside a patient's body, right there on the spot, no giant hospital machine needed. I mean, for care outside a hospital, this thing is a total game changer. So the upsides are just huge, right? It's fast, you can carry it anywhere, and it helps medics figure out who needs help the most, like right away. But here's that catch we talked about. The disadvantages are a massive wall. See, using the machine is one thing, but actually understanding what you're seeing in those fuzzy black and white images, that takes a ton of training. And let's be real, you're not going to find a lot of highly trained sonographers out on a battlefield or at a rural crash site. So naturally, the next big idea was, wait a minute, what if we use AI to help the medics read these scans? It sounds like a perfect solution, right? A brilliant idea. Except the first attempts kind of fell flat on their face.
The first thing researchers tried was pretty straightforward. They just showed the AI a bunch of single static ultrasound pictures. And, in a nice, clean lab setting, it seemed to work okay. But the second you took that AI and put it into a messy, real-time emergency, it couldn't hang. The results weren't just a little off, they were dangerously unreliable.
And when I say unreliable, I mean really unreliable. Look at these numbers. For scans of the bladder, the AI was right only 59% of the time. For the kidney, a little better, 70. I mean, 59%? That's basically a coin flip. There is just no way you can base a life-or-death decision on that.
So, okay, clearly it was back to the drawing board. A totally new approach was needed. And that's when a group of researchers, this time at the U.S. Army Institute of Surgical Research, had this breakthrough idea that changed absolutely everything. They had this realization. The whole reason the first AIs failed is because they were being taught the wrong way. They were being taught in a way that's, well, it's not how human experts work at all. Think about it. A doctor doesn't just look at one freeze frame. No, they move the ultrasound probe around, they're watching a live video, getting context from all these different angles. So they thought, okay, what if we teach the AI to think more like a person?
And their big solution was something they called frame pooling. It's actually a pretty brilliant and simple idea. Instead of giving the AI just one static picture, they gave it a whole short video clip, a pool of about 150 frames all in a row. The analogy here is perfect. If I show you one blurry photo of a car, it's hard to tell what it is. But if I show you a 5-second video of that car driving by, it's obvious. That's exactly what they did for the AI. They gave it the video, they gave it context.
And the way it works is super straightforward. The medic does a totally normal scan, just like they always would. The system then automatically grabs a chunk of that video and bundles the frames together into a sequence. Then, that whole sequence gets fed to the AI, which looks at the entire thing all at once. And by doing that, it gets all that crucial context it was missing before and can make a way, way smarter diagnosis.
So the big question is, did it actually work? Well, work doesn't even begin to cover it. This new method wasn't just a small improvement, it was a total game changer. Honestly, the results are just stunning.
Just look at this. The old AI models were bumping along at around 65% accuracy in real-world tests. But the new model, the one using frame pooling, it rocketed up to an average of 94% accuracy. Let's be clear, that's not just a little step up. That is the difference between a gadget that doesn't work and a legitimate medical tool you can actually trust with someone's life.
And if we break it down, it gets even more impressive. Remember that bladder scan? The one that was basically a coin flip at 59%? That jumped all the way up to 94%. And the kidney scan?
That went from 70% to over 95% accuracy. This is the kind of performance you need. This is the level where a tool stops being an experiment and starts being genuinely useful in a life-or-death situation.
So, what does all of this mean for that medic we were talking about, the one on the ground in that chaotic scene? It means that, very soon, they could have a truly reliable AI co-pilot right there in their pocket.
And the researchers didn't stop there. They built these models on a really powerful AI architecture, and what they found is super important. It wasn't just that the accuracy number was high. The model was consistently reliable across a whole bunch of different, really crucial medical measurements.
And this is why that's such a big deal. See, accuracy just tells you how often it's right overall. But you also need to know about things like precision, which answers the question, when the AI says it sees bleeding, is it actually there? And you need sensitivity, which tells you, of all the people who really are bleeding, how many did the AI catch? And as you can see, the scores here are incredibly high across the board. This proves it's not just a one-trick pony. It's a robust, trustworthy system.
And this really gets to the core of why this is so important. This technology is not about replacing medics, not at all. It's about empowering them. It's a co-pilot. When you're in a super high-stress, chaotic situation, your brain is overloaded. This AI can offload that cognitive burden. Basically, it handles the tough job of interpreting the scan, which takes a huge weight off the medic's shoulders. And that frees them up to focus on what matters most, the patient, and making faster, more confident decisions about who needs help first.
You know, this breakthrough really takes this whole concept out of the pages of a research paper and turns it into a real, viable, life-saving tool. So the question we're left with isn't really if an AI can do this anymore. The question is, how soon will it be in the field? Could an AI co-pilot running right on a medic's handheld device become standard issue for saving lives in some of the toughest places imaginable? It's really starting to look like the answer is yes.